Welcome to this episode of Talking Tinnitus. We're here with our special guest, Dr. Sarah Mathews. Welcome back to the show, Sarah.
Thank you.
So Sarah has a doctorate of audiology from Salus University. She has been seeing tinnitus patients since 2009 and is currently clinically training tinnitus experts on the linear tinnitus treatment device. So today we're asking the question, Sarah, how is tinnitus measured? So how is tinnitus measured?
Well, from a provider standpoint, tinnitus is measured using questionnaires that we have put through all the research and created what we call normative data. These questionnaires typically tend to focus in on different areas of life that may be affected by the tinnitus, and they tend to be pretty wide in the range. With scores of 0 to 100, so that we get a wide range of how impactful is the tinnitus.
Yeah, understood. Okay.
One of the most common ones used is the tinnitus handicap inventory. And that inventory also has some subsections and some areas that focus on sleep, focuses in on emotional reaction to the tinnitus, so that it gives the individual and the provider an option of seeing what's really going on here.
Yeah.
How is this really affecting us? Is there areas in there that we need to dive a little bit more into and focus on to help the individual experience?
Interesting. Okay. So from a questionnaire perspective, there's an aggregate score when the patient answers the questions. And I suppose typically, you mentioned tinnitus handicap inventory or THI, and there's a couple others. TFI, I think, will be another.
Mhm.
Typically, the higher the score means maybe more, the more the tinnitus is bothering the patient. Is that
Correct.
Yeah.
Yeah. 100 being obviously the worst score.
Yep.
0 meaning this doesn't bother me at all.
Sure.
And the higher the score often means that we've got more components that we need to be worried about of that interacting with the patient's life.
Yeah.
So that we've got an emotional component, or we've got, again, like I said, a sleep component, or we may have a daily activity component that those are being.
Yeah.
So it helps us kind of know where is that patient at, and it absolutely helps us get kind of a baseline. Especially since we know that tinnitus fluctuates, they're very helpful to kind of gather a snapshot over a person's life for the last week.
Okay.
Versus how was it today, when today was a good day versus yesterday that was a more prominent.
Sure. And so these questionnaires, whichever one that a clinician might use, they might be done at different points in time where the patient comes in to visit. So, initial assessment and follow-ups and so on and so forth, so that they can track progression. That makes sense.
You got it.
And so I think if we said earlier that, a high score means that maybe the tinnitus is bothering an individual more, I assume it means that if there's a reduction in the score, that means they're improving or could be improving.
Yeah, and that's the exciting thing about the questionnaires having had normative data, is we know how much change is actually statistically significant.
Okay.
Lots of patients have recency amnesia of what I've experienced most recently is the thing that is most bothersome, but we don't necessarily remember what it was like 3 months ago.
Okay.
Or that it was worse or better 3 months ago. So having that data to know how much has changed gives us a good idea of being able to compare when we have that experience of, I know that yesterday was a rough day.
Yeah.
But how difficult was yesterday?
Yeah.
And yes, it was a difficult day, but you are improving enough that we can say that yesterday's difficulty was not as severe
3 months ago.
3 months ago.
Okay, interesting.
Right.
And so you mentioned the word statistically significant or clinically, maybe clinical significance of improvement is obviously a very important concept. So it basically, only 1 point of improvement, it mightn't correlate to a significant improvement in the patient, but something like 20 points, for example, would absolutely be noticeable over a period of time. I guess that's the kind of basic concept.
Yeah, that we have to have enough that we can say,
Sure.
Yeah, that is big enough to say that there's not placebo going on. It's big enough to say that it's not just variation.
Yep.
And those fluctuations that everybody experiences. And it's also fantastic to use in terms of reinforcing what the patient is experiencing as well.
Yeah.
I think I'm doing better. Yeah, your scores show you are. And that is fantastic to have that versus just the unknown of maybe I'm okay, maybe I'm better, I think I have a problem.
Reference point strategy.
And it can be very reinforcing to somebody that goes, okay.
Yeah.
Just like when we step on the scale when we're trying to become healthier and lose weight, and we go, well, my clothes are a little looser, but we see that hard number that says, yeah, you've dropped 5 pounds over the last 2 weeks. It's reinforcing that, yes, what you're experiencing is true. And it is really heading in that direction of change that we want to see.
It's probably important to note that these patient questionnaires, they're kind of universally accepted as a standard in tinnitus. I mean, it's kind of, I believe, practically impossible currently to objectively measure someone's tinnitus. I believe there's early research in Australia that's looking into that area, which would be fantastic, I think.
Yeah.
But these questionnaires, whether it be, I think, the THI or the TFI, and there are others, they're pretty much well established as the standard for clinical practice in terms of measuring tinnitus.
Right. Yeah. And that's an interesting way to look at it, because if we think about the situation where the majority of tinnitus cases can't be heard by somebody else, how do we put a measurement on that? And because it's a perception, we can't say, well, how loud is it? Because it's a perception, we can't say how disturbing is it. So absolutely focusing on the impact of that versus the actual concrete.
Because it might be different for everybody.
Right.
Yeah.
And I've absolutely seen patients over the years that have said, if my tinnitus was located straight in the middle of my head, it would be easier for me to, forget. Whereas I've seen another patient that says, if it was just one ear, I could deal with this.
Sure.
So everybody's measurement of what makes their case difficult or easier or a positive shift and change is different from person to person as well. And these questionnaires level that field.
Okay.
And make it easier for us to really look at, for you as an individual, what you're experiencing is better or the same. And that it makes it so much easier to really look at, we're headed in the right direction, or we need to change your treatment plan because we're not seeing change.
Okay, interesting. Good. Well, thank you very much for joining the show, Sarah. That is how tinnitus is measured, and I suppose any tinnitus expert, audiologist who specialize in tinnitus, these are the types of things, if you go to visit them to discuss treatment and that you're likely to experience.
Absolutely. When you sit down with that audiologist and you go, you want me to fill out 12 pages of questionnaires, this is why. Is so that we can get those baselines and guide you through appropriate.
Paperwork is good. There's good reason for it.
There's a reason why we do it.
Okay, very good. On that note, thanks for joining the show.
You're welcome.